Hi everyone, Dr. Pham with the Reach Center here. We're still talking about adults who have CP and I think honestly other neuromuscular disorders as well. I have started seeing more and more adults who have childhood disabilities, and I think when people are young, it's easier to do different types of bracing and equipment, right? I can have parents and their 5-year-old and say, hey, I think your child needs AFOs. Let's do it. Let's put the AFOs on. Let's get you a walker. Let's, do everything we can to get your child moving. But when I see a 30-year-old and I bring up the possibility of AFOs, I usually get this look like, you're crazy, lady. I'm not wearing those. And so I find that there is a balance, right? We want to allow people to live their lives. My job as a rehab doctor is to give you my best opinion of what can improve your function, improve your biomechanics of walking. And so I might give you 20 different things that will improve all of that. The goal is to really take what works for you and leave the things that don't work for you, or you find a balance of, hey, wow, these AFOs are really great. I'm gonna wear them in the winter when I can cover them up with pants. Or I love these AFOs when I go for a hike, but I don't think that I need them during day-to-day life. So I think there's a balance in adulthood in finding those things that can be very helpful and also integrating them into your life while still living your life as a person who has certain goals and values. So, just because we have all of this bracing and equipment and things like that doesn't mean we force it on you. It means that, we provide suggestions and you decide along with your PT, with your OT, with your rehab doctor, what works for me and how can we integrate that into day-to-day life. The worst brace is the one that sits in your closet because they're very expensive. So if we're getting AFOs, we want to make it such that it works for you and for your lifestyle to improve function. So thanks again for listening.